Okay, great. So let me start. Today's scenario, we are discussing breaking bad news to parents or breaking bad news in a patriotic scenario. Welcome, everybody. Let us begin that. The reason why this discussion is breaking bad news to parents is because breaking a bad news in pediatrics is not quite different from what we do in the adults, but please remember that there are some things I will talk to you about when we start with our presentation. So these things are quite important, and this is of significance. This one little thing is of significance when you break a bad news to adults and when you break a bad news in the pediatric age group. So I will talk about it as we move forward in the presentation, right? So what are we going to do today? We are going to practice the scenario, which we already did. Thank you very much, Dr. Geeta, for that. We are going to talk about some challenges which we face in such situations. What are the solutions to those challenges? I would like to talk about chronology. So I will talk about that and I'll tell you some things, what is relevant in chronology. History taking and management here, basically, I will just briefly talk about how the scenario would be and what your answers should be, and that's about it. Then, if you have any questions, you can ask us. For those of you who have just joined my group, so welcome to the group. And what we do is every week we pick a topic, we practice, and then we discuss. And what if, due to any reason, you have missed the discussion? What you can do is you can head over to my YouTube channel and you can view the discussion over there. So not only that, if sometimes you want some guidance for certain topics, even then the recordings are very useful. So you can go and you can take a look at the channel and also see what things we have discussed, right? Okay, so let's begin. The scenario today was you are a junior doctor in the emergency department. John, aged 9, had a road traffic accident and was brought to the hospital confused. The trauma assessment team has been looking after the child ever since. As a part of the assessment, a fast scan was done and it showed that the child has a ruptured spleen. Surgery has been planned and the child is being prepared to be shifted to the operating room. You have not yet seen the child. You have been asked to talk to the child's mother, Ms. Samantha Alexander. Please talk to this mother and address her concerns, explain her about the child's current situation. So this scenario is a little different from what you may have with you, but the content of the scenario is still the same. It is about talking to a distressed parent regarding the situation of their child. Okay. Things to note over here is that the sequence of events and what is your task. Also, who are you and where are you located? So all these things, all this information is given to you in the question. The questions of ethics scenarios are quite long and the order of the events is always given in the question itself. So it would be a good idea to stand at the door and look at the order of the questions when you have it. Okay, there may be some minor changes here and there. It is also a very good idea to note those changes while you are at the door, right? Now, what are the challenges that we face in this scenario? So some things I'm going to talk about is transference. What is transference? What are the components of transference? What do you expect when you go inside in the cubicle? Yes, we are going to talk about these things. So first, let me start with what is transference. Transference is basically what you put into the environment is what you give back. For example, if you put a diffuser in the environment, right, you get a nice smelling fragrance in your room. So that is transference. So basically, what I'm trying to say is, if you enter inside and you see an anxious or a very nervous parent who is already there, it is possible that you might pick up on their vibes and present the same vibes back to them. Okay, so that is the process of transference. For that reason, the doctor who enters inside must enter by changing the environment. So if you are calm and composed yourself, so when you enter the environment, you are going to present the anxious relative with the dose of the calmness that you have within you. And how does that come? It only comes with practice. If you do not practice, especially these scenarios, it might be difficult to navigate through them. So this is what transference is about. I hope I have made sense. I hope you have followed me when I said that. Now, coming to what you may see inside in the cubicle. There may be parents, there may be one parent or two parents, depending on how the situation is, right? They may not be ready to receive the news that you are going to give them. There may be an atmosphere of anxiety and nervousness inside. What happens is there might not be enough communication between the team members to deliver the news, which is quite evident from the question because it tells you that you have not yet seen the child, yet you are asked to talk to the parent, right? Sometimes when you enter, what happens is there is quite an anxious parent, or there are quite anxious parents who want to rush and they want to know if their child is going to be all right or not. What can be your challenges? You can't gather enough data. You may be feeling anxious as well. Minimum information on the question, and you have no idea about the family background. These can be some of the challenges that you may face. And also, there may be a misleading direction of how much amount of information you need to convey to this parent. That can happen also, right? So these are some of the things which are challenges. Now let's talk about how can you give solutions for all of this. Okay, like I said, for transference, place yourself in that environment. So be calm, be comfortable, and be confident. If you see that the parent is standing, offer them a seat. Ensure that they are comfortable when you are speaking to them. If they are rushing you to talk, to tell you what's going on with their child, then make sure that you acknowledge the fact that they are anxious and let them know that you are here to speak to them regarding the same. Now, like I said, it would be the best thing that you would do if you have worked on your issues before you enter the exam. So place a calm, comfortable person in the room. If you are nervous or anxious while you're talking to this parent and you end up making them more nervous and anxious, then the result might not be very good. Okay. The other suggestion or solution that I have for you is try to take a data gathering limited to 4 to 5 questions before you start addressing the issue. What happens is after you have addressed the issue, the parent will not be cooperative to talk to you about the history. Okay? They may just say thank you and sit down and not ask or not answer anything else. So data gathering ideally should be done in the first 4 minutes of when you enter the queue. Okay, let's go on. Let's move on. So when I talk about chronology, you will understand what I'm trying to say. Okay, right. So what is chronology? What is the significance of chronology? And I'm also going to talk a little bit about mind map. Okay. Now basically, what is chronology is? It is the sequence of events. What is the significance of this is that it helps you convey to the parent a much better answer. Okay, if you miss out parts of chronology and you go on to talking about what's going to happen with the child right now, you may lose some scores, you may finish the scenario faster, and the parent may not understand anything that you're trying to say. That is the significance of chronology. Now, I said that there is a difference between breaking a bad news in pediatrics and breaking a bad news in adults. The difference is that when you are conveying this sudden news to a parent, 93% of parents, according to a study, say that We remember each and every detail of what happened and who spoke to us. We did not like what was conveyed to us. We did not like the way it was conveyed to us. Okay, so this is a study which was done, and it says 93% of the parents are unsatisfied. So your job here is to, like I said, practice and be aware of the sequence of events. It is definitely going to help you, because if you remember the sequence of events and you go through them step by step, okay, it demonstrates empathy in a very good way. You want this patient to think back and think that, yes, I was conveyed this bad news, but the doctor was very understanding. You have to decide what sort of a memory in this parent's mind you want yourself to be present as. My advice would be, even if it is a test that you are taking and you have to demonstrate this, when the simulator is asked, so what do you think of this candidate? Give them a reason, or give them the reason why they should say that I think this candidate was very understanding. Okay, so this is what my advice is. Right. Now let's talk about chronology. What is this? How do you arrange everything? Right. So like I said, it is the sequence of events which have occurred. What is its significance? It demonstrates preparedness and professionalism. And I also told you just now that when you go step by step, it demonstrates empathy and it gives a much better outlook on the candidate. And as a doctor, also, please remember, you want people to remember you as an understanding doctor, not as someone who is confused. So avoid doing that. Okay. What are the steps of the event? Like I said, who and where are you? What was the event that happened? What is the child's present status? What and by whom was the child managed? What was the diagnosis? What is being done? What is going to be done? And what is expected of you? So these are the things which you need to keep in mind when you go through the chronology. So I'll tell you according to this question. You are a junior doctor. You are located in the emergency department. What was the event? The child met with a road traffic accident and he was brought to the hospital. Initially, he was confused, the child's status, and now he's being prepared for a surgery. What was done? I just told you. The trauma team had taken care of the child, and as a part of that, a lot of tests were done. One of the tests was a FAST scan. The diagnosis showed, or because of the FAST scan, what the diagnosis we saw was that it was a ruptured spleen. What is the treatment for ruptured spleen? It is continuous observation, monitoring, and surgery. What is expected of you as in the FY2 or the junior doctor is to talk to the mother, address her concerns, explain about the child's situation. Okay. Now, please remember that these are highly sensitive situations, okay? And we also want to know something else, which is mind map. So, like I said, when you are at the door, it could be a good idea to have a mind map before you enter inside and begin your scenario. So, what does the mind map consist of? It has three components: chronology, data gathering, and management. Chronology are the questions I just showed you, which is this. Okay, this is a part of the chronology. Try to follow this order as much as possible. The simulator may try and confuse you, but it is advisable that you go through each and every step as it is written and don't make the fourth step your seventh step. Okay, don't do those kind of things. Go by the order. Okay. Data gathering limited to 5 questions, which I already told you. Management. What are the things in management? I will talk about it in a little bit of time. Management is quite simple, but it's quite different from the other scenarios which you may have. Okay, moving on. Apart from the chronology, what else is important? You are dealing with a breaking bad news scenario, so of course you need to know the spikes protocol, which is setting, perception, invitation, knowledge, empathy and emotions, strategy, and summary. Okay. Now this scenario, you may not be able to follow the protocol as it goes. However, as an examiner, they are always looking for all the components to be there in the presentation of the candidate. So please remember, Spikes protocol is very important. So what can you do regarding the Spikes protocol? How do you know which part comes where? Empathy and emotions is tested throughout the three parts of the um, scenario, that is during chronology, during data gathering, during management, during all these three components, empathy and emotions is being tested. Okay. Setting, perception, invitation, and knowledge. These four parts come under data gathering and chronology. Strategy and summary. Please remember, strategy and summary is the part of management. Now you understand why I said management is a little different. I hope you understood. It's because you have to talk about what is the plan going forward and what are we going to do. You have to summarize everything and then leave. So that is what is expected of you, especially in such scenarios. You can take the information I'm presenting here and apply it for the adult scenarios too. It's not a big deal. However, these are the components of a Breaking Bad news. The more you know them, the more prepared you would be, right? Now let's talk about what does the GMC UK say regarding Breaking Bad news. Okay, this is my favorite slide, so I won't be spending I won't be spending a lot of time on it, but yes, this is my favorite site because I really like to reiterate what does the GMC UK say about these things. Okay, so definitely, GMC UK, what does it say is that they have a model for Breaking Bad news. You can go on the GMC UK website. You can just type in Breaking Bad news on the search bar, and you will find this model. It says that it has three components: what, so what, and what now. What they are trying to tell you by this model is that it would be a good idea to practice your approach to this scenario using the spikes protocol. This is what they are trying to tell you, that if you have ever faced a situation of breaking a bad news, take a diary and write down what did you do. So what was the outcome of what you did, and what would you like to do now, or what they expect is that the next time if you are faced with a breaking bad news, you have incorporated what you did earlier and you make your approach a much better one. Okay, this is what is expected of you. Now, most of us know details regarding these scenarios. Okay, we may be repeaters, so we may have first-hand experience of what goes on in this. So it would actually be a very good idea to sit and write down what happened when I went in the first time, what did I do, and what I would do now. Okay, so instead of listening to someone's experience who did something and they passed, my advice would be practice frequently and keep changing your approach to this scenario. Okay, that is the best thing that you can do. Why? Because you have this protocol with you, and most of the details regarding this protocol is available on the internet and on YouTube, everywhere, wherever you would like to look. You can find information. It's not that it's impossible. Okay. Now let's talk about what happens. Okay, what is the data gathering? What can you do over here? So like I said, in the spikes protocol, we go back to the spikes protocol, the setting is already arranged for you because it's a test atmosphere. Perception. Here comes the part where you enter and you find an anxious parent or two anxious parents. Okay, this part comes under perception. Okay. What you would do is normally you would introduce yourself, confirm their identity. If they are standing up, if they are asking you a lot of questions, please be calm and composed. Allow them to ask you questions. Don't interrupt them. Let them finish all of their questions. And when they have finished and they give you the non-verbal cue to start or they pause, acknowledge that they are anxious. Okay, so what can you tell these parents is you can use phrases like, I can see that you're quite anxious. Given the circumstances, it is quite natural to feel that way. Full stop. I have been asked to speak to you regarding your son, John, but before I begin, I would like to ask you a few questions just to make sure that I can explain you better what is going on. Is that okay with you, Mrs. Alexander or Mr. Alexander, whoever is there, depending on that? Okay. These are the two things you can demonstrate: emotions, empathy, and you can also convince these anxious parents that I do need to ask a few questions. Please bear with me, please answer me, and I will answer everything regarding your child. Okay. Now, when I say practice and try to find out things you can use on your own, you can make these phrases which I have said smaller, shorter, by using some really, really good vocabulary, by using, an online dictionary, synonyms, all of that. You can actually do these experiments and make these phrases smaller and more impactful. You can do that. If you're interested, if you have time before attending the exam, definitely you can do that. If you want help, if you want to, um, you know, want some guidance from someone and you want to know whether you're on the right track or not, you can text on the group and you can ask me, and I may be able to answer you if it's right or wrong. Okay, so don't worry about that. All this experiment should happen before the exam and not during. Okay, so that's also something you should keep in mind. Now, moving on. What are the questions in data gathering? So these are the 5 questions that I think the patient would cooperate and answer. Apart from this, they may or may not answer you anything else. Okay. First thing, has anybody else spoken to you before me? Would you like someone to be there in the room, right, for your support? Now, before you start asking the details about the event, please signpost, issue the warning shot. How would you do that? It would be really difficult. However, can you please tell me some details about the event? They signpost and then ask about the event. After they have spoken about the event, please tell them, for I'm so sorry regarding what has happened to John, but could you just tell me, did you notice any visible injuries? Okay. Instead of giving her ideas, did you notice any bleeding from the nose? Did you notice any bleeding from the mouth? Did you notice any wounds on the head? Instead of asking all of that, just ask her this one question: did you notice any visible injuries? She will say, no, doctor, I even if I did, I can't recollect right now. I'm just very anxious. I want to know how is my son. Right. Okay. So, yes, you're right, Mrs. Alexander. I do want to talk to you regarding your son. So, before that, do you want to know all the information regarding what's going on with him, or would you just like a summary? Okay, so obviously, she's going to say, just tell me everything, doctor. I want to know everything. This is what she is going to tell you. Now, now comes, how do you speak to her? Okay, so arrange your chronology. This is what I'm saying. Arrange it. After the event, as you mentioned, your son was brought here to the emergency. A team of capable professionals like surgeons, physicians, and nurses have been looking after him. Are you following me, Mr. Alexander, or Mrs. Alexander in this case? Yes, yes, doctor, I'm following you. Your son is being continuously observed and monitored by them. Some tests were done as a part of this. Would you like to know more about this? Yes, yes, doctor, please tell me what's going on. Well, a jelly scan was done. In other words, we call it as a fast scan, and the results are not what we were expecting. Pause. Doctor, what is going on with my son? Please tell me. Yes, well, the results show that your son is critical and would require immediate surgery. Pause. Allow the simulator to give you reactions, okay, and ask you questions. Please don't interrupt them. Once they are done, then you can ask them, I can see how difficult it is for you. Can I tell you more details regarding this? She'll say, yes, yes, please tell me, what is this? I do not understand anything about this. You have to say, there is an organ in the body which is called the spleen. It is located on the left side of the body in the tummy. I'm so sorry, but I have to inform you that this gland or this organ has been injured due to the impact of the accident. Pause. We found this out when we did the jelly scan. Pause. If she is not saying anything, then you can continue. Otherwise, if she says, Doctor, does that mean my son is going to die? Now, this answer, answer to a critical question like, is my child going to die? Please remember that this answer should be a three-part answer. What are the three parts? Acknowledge the circumstance, reiterate management plan, and talk about team capability. Now, what do I mean when I say this is, how you answer this question is, instead of saying, yes, it means your son is very critical, he is going to die, do not say those kind of answers. Your answer should be, I can see how it is quite concerning, Mrs. Alexander. Being a mother, I'm quite sure this is not easy for you to hear about your child. As I mentioned, reiterating management plan. That's what I'm doing now. As I mentioned, your son would be taken up for a surgery for this, and a team of capable doctors and nurses are assigned for him and they are looking after him. He is being prepared to go in for the surgery. Pause. Okay. Give her some time once again. And when she is ready, when she looks like she's ready, then you can continue. Or if she asks you, Doctor, can I see him? Can I see him? Now, I'll answer this question in a bit. But one thing I do want to tell you, please avoid using statements such as, don't worry, I'm here now. Don't worry, you can always ask me anything regarding the surgery or what's going to happen. Don't worry, your son is going to be absolutely fine. This has happened with me too. Look, I'm here and I'm a doctor today. Please do not use these kind of phrases. Okay, this is why I've written there is a thin line between hope and false hope. Okay, and our duty as a medical health professional is to not take away all the hope and at the same time do not give false hope. When you say things such as, do not worry, I'm here for you, do not worry, you can always ask me anything you want, do not worry, you can always approach me anytime you want, do not worry, your son is going to be absolutely fine. When you use phrases like that, you are giving this patient false hope. Why? Because the patient will worry, sorry, the simulator will worry. It's their child whose life is at stake. First thing. Second thing, you cannot always be there for someone, okay? Especially as, a medical health professional, you will have not one patient or one case to take care of. You may be assigned more than one case on a particular day. It is not possible that you can be there for someone all the time. Okay, so please do not say phrases like this and get yourself in trouble. Okay. Instead of that, what you can say is, can I call someone for your support? So call someone for support. That is much better than telling this patient that, I'm here, you can ask me anything, you can ask me anytime. Here is my bleep number. You can always, contact me and I will come to you. These things are not possible. So please do not say these things in the exam. And even in your real life when you are practicing, do not give these kind of false hope phrases. It's better to be direct, to talk, to acknowledge, talk about the management plan, talk about the capability of the team, rather than speaking about things which you cannot do practically. Okay, practically, it is impossible. Okay. So my advice is please avoid those kind of statements. Right. Moving on. Like I said, those were danger phrases. Don't worry, I'm here now. You can always ask me, I'm here. Do not use these phrases, guys. This is just danger. You cannot be there for someone any time of the day or night. You cannot tell someone that this particular case is of interest to me and I don't care about the rest of the patients I may be assigned to on a particular day. So that's why these phrases are danger phrases. Do not use them. This is my advice. Please, it does not look good. And this is why I keep saying that keep practicing and keep thinking of new ways, innovative ways in which you can make yourself better. Okay. Now, let's move on to management. Okay, so like I said, what is different in these scenarios is that management is a little different. So you need to, when I say strategy press summary is what management consists of in breaking bad news. What I mean is it has a 7-part point system which you should incorporate into your practice. Then you would know. Now, what are these points? When you talk to this mother, explaining her the plan of management, which I already did some time ago. After you think everything is done, but it's not. The GMC UK says that you have to inform short-term and long-term effects of any procedure which is going to be done, especially when you're dealing with ethics scenarios. So please do tell this mother what are the short-term and long-term effects. What are the short-term effects? Infection and bleeding. Okay, these are the two um, complications or effects of the procedure. We can handle them. Infections are managed by giving antibiotics, and bleeding is managed by reserving matched blood. One small sentence, it's over. No need to explain her the entire process of cross matching and all of that. You are not being tested for that. Okay. What are the long-term effects of this procedure? Long-term effects are, well, there may be some discomfort to the child, there may be hospital stay, and the child needs to stay away from contact sports until advised by the specialist. Okay, so these are some long-term effects of the procedure. Okay, when you finish your management, you need to talk about these things. That is, you will look into giving an opportunity to allow her to speak to other senior team members. When she says, "Can I see him, doctor? Please, I want to see my son." I will look into it, what can be arranged, right? And offer arrangements for their support. So once again, you can ask over here, is there anyone else I can make a call for your support? I'd like to give you some leaflets which you can read, right, for more information. Not right now, even if after some time. I just keep them here for your information. You can just read them whenever you are okay. Okay. Now, this is the management that you need to do. Summary, you have time, you can summarize. So what is your summary? Summary points consist of, is there anything else I can do for you, Mrs. Alexander? If she says no, so just tell her, all right, but let me summarize what I would do now. So what first thing I would do is, I would look into if I can arrange for you to see your son, first thing. Second thing, I will arrange a meeting with my team members for you to meet with them and get more information regarding your son, John. I will also give you some leaflets. I'll leave them over here so you can take a look at them later. And your last part of the scenario, which is assurance, what will you say here is that, indeed, this is a difficult situation, Mrs. Alexander, but you are a brave mother. If you would like to speak to any of us, please do not hesitate, let us know. If you want to call someone for your support and need our assistance in this regard, please let us know. Thank the mother and done. You're done. Okay. This is what management should ideally look like in this scenario. Refrain from talking about lengthy procedures and what and all is going to happen to the child. You are not being tested for what knowledge you have regarding the procedures. You are being tested for communication skills in this scenario. And what I did here is I made your management from 2 minutes to 4 minutes. Okay, so I made quite a long management for you. The reason why is because this simulator or this parent will only answer 3 to 4 or 4 to 5 questions, not more than that. If you try to ask them other questions like what did the child eat before the event, right? If they have any other medical conditions, she may or may not answer. It depends the time that you ask. And it also depends you have if you have taken this parent into confidence in the beginning itself, then they may answer you. If you have not, then they may not answer you. Okay? So it's very important to be calm and composed, very confident even when you enter this scenario. If you are going to think in your mind that I have not prepared for this, I'm not ready for this, and you enter the scenario, then it may go haywire. I cannot guarantee that you may be successful at this. So for that reason, please remember these are not scenarios that you can do, when you have just 2 days left for your exam, you need to prepare for them for quite some time. You need to be prepared beforehand. Okay, these are very important ones, easy to score ones. You need to use your emotional intelligence to pass these scenarios. Okay, and like I said, you are not being tested for your medical knowledge regarding ruptured spleen or a fracture or a hematoma. You're not being tested for that. You are being tested for emotional intelligence, medical ethics, knowledge, and patient communication. Very, very important is communication skills. What is the most important is arranging your chronology, checking the understanding, and warning shots, issuing those, avoiding these danger phrases, and assurance and summary. Please remember, summary is very important. Even if you have half a minute or 1 minute before finishing, you can summarize and then thank the patient, the simulator, and excuse yourself. Okay, that looks much better. Right. What else I want to say? I think that's all. And like I said in the beginning, please try to give yourself and the people involved in this a memory of comfort. When they look back, they should think, okay, yes, this doctor was very kind. You do not want them to say anything otherwise. Please remember that importance of this scenario. If you are attending a job interview, you will definitely be quizzed regarding how you are going to deal with this. So please don't think that this is something that you are allowed to fail, or this is something that you can pass, give a pass as in not care about it and then it will be fine. It's not like that. Things are changing now. Please be very well aware, practice this scenario often. Okay. Any questions on the group? Yes, please let me know. I'll be answering questions now. You want me to repeat something? You want me to clear something? Please let me know. I will talk about it. For those of you who are new, please subscribe to my channel because this one will be uploaded on the YouTube channel the next day. And I also have a Facebook page, so if you want, you can like the page. I talk about tips and tricks, and sometimes I might be even putting out some information over there, so you can get all of that from the page. And yes, please do support me. Attend the session on time. Attendance is really important, so please do attend. Please do subscribe. Any way you can support me, I'm very grateful for that. I also want you to yes, I would also like to thank you all for submitting the feedback. I was very happy to read all of them. There was one feedback though, which was very honest, and I really, really liked it, and that was by Dr. Peter, Prince Peter, I think. Yes, very honest, very. It was a very nice feedback. I really enjoyed reading that, and I thought this is something I really need to incorporate. And I tried to go slow today. I hope that I went slow. I'm not. So if you think I was too fast, then you can ask me to repeat. I will repeat it right now. Okay. Do we need to ask about objection of blood transfusion here? Well, the task doesn't tell you about asking about objection of blood transfusion over here, right? Doesn't say anything of that sort. What it tells you is your task is to go and talk to this mother regarding what's been going on. Okay, so this is what is important. Objection of blood transfusion is not a very important question. There's quite a lot you need to do. I just spoke about those things here. Like I said, strategy and management is very, very important. Okay, strategy and management is something which you should be focused on, like incorporating emotions and empathy in your answers, going slow, checking understanding, making sure that this mother, she is able to comprehend what you're telling her. So all these things are more important than asking about the last meal, blood transfusions, and any other medical conditions. She may or she may not answer. Like I said, it depends. However, 5 to 6, 4 to 5 questions or 5 to 6 questions she will definitely answer. So make sure that you ask those appropriate ones. But objection of blood transfusion here is something which there's no need for you to ask this question. What you can do instead is, after you have summarized, you can answer, is there any concerns regarding John that you would like us to know? Is there any medical conditions or any objections that you may have regarding his treatment? Do you want us to know anything in this regard? Please let us know. Okay, so just put it out there that I do have this in mind. I don't want to talk about it, but I will not do it now, maybe later. So that would be a much better approach. Okay. My channel name, it's the same. It's My by the Book. Okay. The YouTube channel name and Facebook page channel name is the same. It's My by the Book. Thank you very much. Thank you everyone for attending the session. I hope that you have understood what I was trying to tell you, and this session has been useful. I did incorporate a lot of changes in this, and the reason for that is because, yes, once again, going through the GMC-uk guidelines for breaking bad news, and what information I could find over there is what I have compiled and made this presentation for you. So I hope that has been helpful. Okay, right. So I'll see you all on Saturday, and please let me know who would like to practice on Saturday. Give me 2 names, because if someone is not able to attend because of any reason, then the other person can practice. You are welcome. Thank you so much, everyone, for attending the session. Thank you.